There, you guys. Today, I wanted to give you six of the major contributors to poor gut health. So, we know the gut is so important to our overall wellness. So, I want you to think around as I'm talking around these six different things that can cause you to have poor gut health and see how many of these may resonate with you, may be affecting you. So, number one, and this is probably the one that most people, and myself included, I was there, I was in the same spot several years ago, don't want to deal with, and that is stress. Stress is so important. Having low stress, it's so important to our overall well being. We probably won't ever get rid of all the stress in our lives because we just really live in a stressful world. But there is a huge gut brain connection, and stress is a leading cause of dysbiosis and leaky gut. I had both of those. And honestly, I improved by doing some of the healthy things and treating some of the other issues that I had. But I never got completely better and rid of the symptoms that I had until I dealt with the stress. So that is key. Number two is antibiotic use, especially repetitive antibiotic use, multiple rounds of antibiotics. It contributes not only to antibiotic resistance, but it also wipes out the good normal bacterial flora in the gut. And studies show that it takes about 6 months for that good flora to recover, and for things to kind of repopulate. So maybe you've been on a lot of antibiotics. That's one thing that really contributes to poor gut health. Three, this is a common one as well, chronic NSAID use or non-steroidal anti-inflammatory drugs. These are things like ibuprofen, Aleve. This has been shown, this class of drugs has been shown to negatively affect the balance of the gut microbiome. So, again, cause some of that dysbiosis, that imbalance of good and bad bacteria. We know that chronic use of these medications also can cause ulcers, bleeding, and it can also cause something called mucosal erythema, which is basically like inflammation and redness of the mucosal lining in the GI tract. Number four, this is one that I definitely had, gut infections. So, pathogens in the gut, bad pathogens, can really wreak havoc on the gut and cause a ton of symptoms. Things like pain, bloating, gas, constipation, or diarrhea. Even things like anxiety, a low immune system, joint pain, skin breakouts, food cravings. All of these things that I just mentioned can be signs and symptoms of an underlying gut infection. It doesn't have to just be, gut symptoms or manifestations of gut symptoms. And this is why we test. This is why I'm a big proponent of GI map testing. It helps us to really stop guessing what's going on and really get to the root of the problem, and look beneath the surface. Number five is processed foods. We could probably all do better with eating less processed foods. Um, Processed foods have no nutritional value. They don't have any fiber. They often have high levels of trans fats, and this causes massive inflammation in the body. And actually, these processed foods kill healthy bacteria that we need to stay well and to have that good balance in the gut. The harmful bacteria actually feed and grow and multiply off of these processed foods as well. So, eating more whole, real foods and cutting out or cutting back on the processed foods will really be helpful. And then number six is poor sleep. Now, again, there's a huge gut brain connection. Our nervous system and our microbiome are in constant communication with each other. And this regulates hormone production, immune system function, it regulates appetite, digestion, metabolism, stress, and mood responses. So, really making sure you are getting that adequate 7 to 9 hours of sleep. It varies person to person with what your body needs. So really, listening to your body, but making it a point to really try and get that good deep sleep is so incredibly important. So let's recap the the 6 major contributors to poor gut health. Number 1 is stress. Number 2 is antibiotic use. Number 3 is chronic non-steroidal anti-inflammatory use. 4 is gut infections. 5 is processed foods. And 6 is poor sleep. So kind of think around, which of these do you have? Which of these areas can you make modifications in? And maybe just start with one thing. Maybe you're like, well, I don't sleep good at all. Well, what are the things? Take a good look at your sleep habits, your, patterns of what you're doing before you go to bed, what might be causing you to not sleep as well. Are you just not going to bed early enough? And just commit to, this week, I'm going to make a change in one of these areas. And once you make that change and create a better habit, then you start to make changes in another area. And that's really how we, get to our highest state of wellness. Is it's a process, and we're just, making small tweaks and modifications as time goes on. So I hope this was helpful, and I'll see you guys soon. Have a great day.